Skerritt. I'd like to change topics a little bit.
Good.
And I'm probably going on to a subject that doesn't get as much attention as it should at these, but the issue is of male and female sexual dysfunction and approval for drugs. Now, I understand that, does the TGA have guidelines for the industry on male sexual dysfunction?
Guidelines in general or guidelines for the review of medicines?
Both. So I'll just explain. So what's been brought to my attention is that there's a very successful pharmaceutical company in Western Australia that for many years has been TGA approved facility, has been producing what's called androfem medication for both men and women. And due to some rather oddities between state and federal guidelines, is they've been manufacturing and successfully selling here and overseas the male product for male sexual dysfunction, but the identical product for women, while approved in Western Australia. So it's called androfem and is perfectly legal to prescribe in Western Australia and is prescribed in rather large quantities, but it's also then prescribed in WA for women interstate. Now, I understand they've been going through the merry-go-round because they advised me that there's no guidelines for industry on these type of medications for women, but there is for men. And it just makes me wonder why it's okay to sell these products in WA for men and women, but nowhere else.
I'll seek some further comment from Murray Kelly if he's here, but while we follow a lot of European Medicines Agency guidelines for general disease classes and so forth, I'm not aware that there's, and so Australia, as part of not duplicating international regulatory effort, tends to follow the EMA, the European Medicines Agency guidelines for a range of diseases and conditions, so medicines for bronchitis, medicines for this, medicines for that. I'm not aware that there's a guideline as specific as relating to male and female sexual dysfunction. I'll check with my colleague. I'd also add that there are differences when a medicine is only supplied within a state's borders, even as large a state as WA, different regulations, largely controlled by the state, apply. Remember, our role as a Commonwealth body is obviously limited by the constraints under the Constitution.
I understand that, but I think it's safe to say that women with sexual dysfunction problems don't just reside in Western Australia. And if there's a medication that's been produced there for many years that has so far proved to be very safe.
So again, Senator, as I've said in the case of medicinal cannabis products and so on, it is open to a company to submit a dossier. There's detailed information on our website, and indeed we can provide it through our regulatory assistance people, on how to submit an application for a medicine.
Well, to clarify, so I understand that is the process, but there's no draft guidelines or guidelines for women. Now, the FDA have issued draft guidelines for women because this is not a problem just for women in Australia, it is a problem for women internationally. So that there are now draft guidelines out for the FDA.
Yeah, we don't have to wait until there's a specific guideline. We have some medicines for some fairly weird and wonderful things, and each product is assessed on its merits.
Are you saying that this is a weird and wonderful thing?
Well, no, we have medicines for some very rare and unusual conditions for which no one would have ever written a condition.
That it's blokes assessing this,
but we can
women.
still assess it. So.
Order. I think Professor Skerritt, if you...
We don't have any guidelines. No, we would very much welcome an application from this company.
Well, I understand
and they're welcome to pick up the phone and talk
I understand that the company has... Maybe if you could take this on notice, because I understand that the company has gone through a number of rounds of processes with the TGA, and something happens and then it has to go right back to the beginning again. So if you could take that on notice...
We'll take it on notice.
I think the women of Australia would be very happy with you. Thank you.